With the coronavirus now being classified as a pandemic by the World Health Organization, what exactly are the symptoms of the virus? And if you're feeling sick, can you tell based on your symptoms whether or not you have it?
You really can't tell, not at first anyway.
Dr. Matthew Dybel with Covenant Emergency Care Center says if you start to develop a cough or fever, it doesn't mean you have the coronavirus, because he says its symptoms are very similar to the flu.
If it's just a cough, fever, stay home. There is not a point in coming to the emergency department.
However, he says one of the key differences between the coronavirus and the flu is this.
Now, on the other hand, if you're having a hard time breathing, just like any other illness, you come over to the emergency department. If needed, call 911 first.
But Dybel says even for those who catch the virus, there is some good news in all of this.
Most people actually have very mild symptoms. Roughly 80% are just going to have kind of a cough, shortness of breath, maybe a low-grade fever, but they're really just going to have nothing more than what kind of feels like a bad cold. However, we do know that for some people, particularly the elderly, and also those with lots of medical problems, they're at risk for this mild illness to become much, much worse.
Which is why he's advising people to speak up and ask a doctor about their symptoms before going to the hospital.
If you ever have a question and you're not sure what to do, give your doctor a call and they will help advise you where to go.
In Saginaw, Jonathan Jackson, WNEM TV 5.